Welcome to Influence Interviews, where my mission is to introduce you to people who will have a positive impact on your practice because of their expertise, their experience, and their example of great leadership. Today, my guest is Laurie Owens. Laurie brings over 18 years of experience in educating dental practices on medical billing insurance and the techniques to get claims paid. Welcome, Laurie. I'm so grateful to have you on our Influence interview this morning.
I am so glad to be here. And if you hear squeaking in the background, my dog is making sure you know he's here. And no matter what I do, this English bulldog has a mind of his own. So
Well,
I'm
we
so glad
welcome
to be
him
here.
as well. Tell us, Laurie, I think you and I have had several conversations. You are a very smart, talented lady. Your services are so amazing, but I'm pretty new to them. So I would love for my audience to understand a little bit more about the medical side and how you get started in medical billing in your dental practice.
Absolutely. So part of one of the things that I try to help offices, because if I unloaded everything that I know, it literally will make you not want to do it because there's so much. And so we try to focus on what do you not get covered for dental insurance. And let's focus on that because there's literally a reason why. If it's not a covered benefit under dental, it's usually because it's a medical service. So let's figure out why this service needs to be done on this particular patient. And let's go with that to start. Bone grafting, membranes, cone beams. So if we pick three things that you can start with, then you can start building upon that, adding to it. Because I always tell dentists, I was speaking to a dentist in Hawaii a couple days ago, and I said, "Did you know that there's a code, a diagnosis code for dental caries on smooth surface extending into the pulp?" Most people don't know there is a diagnosis code. Who can use that, do you think? Can a medical doctor use that code? No, it's in the oral cavity. That is a dentist area of licensure. So we have to think about why these codes have been created are not for medical doctors. They're for dentistry. And so again, I'm not saying I want you to go and do caries, but if you have somebody who's diabetic or xerostomach or autoimmune, that might be a good cause of why you have 6 caries lesions to correct. So it's something to rethink of using their benefits in the appropriate way. So the things that aren't covered in dentistry, what have you got to lose, really?
Right, right. Wow. Okay, so that is very interesting because I wondered how I didn't realize there were such specific codes related to dentistry. You
Yes.
just mentioned, all of these medical conditions. Will you talk just briefly about the oral systemic conditions in your and
Oh,
how
yes.
that plays
So
into all of this?
it's so linked for diabetics that diabetics, when we code that, it is only one code for diabetes with perio or diabetes with oral complications. It's that is the code. You don't need to use two codes because it's really one code. And so we have to rethink if this has already come about within the medical realm, why are we avoiding it? It's kind of I know it's scary. I know it's unknown, but why we created the software that we have is because we want to support the office. I could do claims all day long. Those are the easy things. It's the follow up that I think that most
Mhm.
people are afraid of because it's time consuming. So with our software, that's what we do. Behind the scenes, we're updating your cases. We're telling you what the conversation was. So you could say, and I go back to my at the practice, people would say, "Hey, Lori, what's going on with my medical claim?" And I'll call in a couple weeks as long as I don't have double doctors. And I felt horrible because I know they want to know, but I don't have time.
Right.
And so what we did in the software is everything is due dated. So we have to call when a claim is submitted from 30 days out and then every 2 weeks thereafter. but we let you know what happens. So when that same patient walks in, I can log in and say, our billers called on this day. This is what happened, and they're going to call again on this day, because we want our offices to look smart, to look like they're on top of it.
Right.
So, yes, it might take a little bit of time to start you out. Yes, I'm not going to lie. I'm not going to tell you you're going to get a check in 2 weeks. Once we get established with those medicals, the money starts coming in faster because they
Well,
know you're serious now.
I love that you said that. Well, lots of the things that you just said, but what I realize is I think I don't know enough about what your actual services are, because I know you're an educator. I know you travel the country and
Yeah.
you educate practices. I know you train in that space, but get a little bit more specific about the different
Sure.
services that you
Well,
offer.
one of the other things I wanted to mention too, we were talking about medical, is so they just came out with a new code this year for sojourns, because we know how much it affects. So it's sojourns with dental involvement.
Oh.
So isn't that interesting that that is now a brand new diagnosis code that just came up this year? So that's why I wanted to mention, because it's not just the diabetes, there are
Right.
other things that have oral involvement, and they're recognizing this as a problem. And so why our software? So our software will take your dental code, you put in your D6010, and we're going to tell you, is it 1 to 3 implants for a 21248, or is it 4 or more? Because 4 or more would be a different code, because you're going from a partial arch to a complete arch. Because 4 or more is considered complete, even if they have
Okay.
dentition still there.
Okay.
And so we just guide you into that dental code, to what it crosses into medical, and what would be a primary diagnosis code for that particular service. And so we can't choose the codes for you because they're not our patient, but we
Right.
can guide.
Okay.
And then we also provide the support that goes with it. So I love that every claim that you start can be saved as a draft, and I can hop in and look at it and say, I just did that this morning. They said, I don't know what I did, did I do this right? And so I hopped in, I said, you did it great. The only thing you needed was a modifier, because all they did was place an abutment. And so we have a modifier that reduces the service because they didn't complete the code. Does that make sense? So
Yes.
the implant code is the implant placement and the abutment. So when you only do part, we modify it so that we can explain it without writing things to the medical insurance. And they were actually paid on the implant placement. So now they're doing the abutment side.
Wow. Wow. Okay. How how many practices do you think are losing money or they're losing money, their patients aren't getting things covered, they're losing money? How often does this happen? I feel like medical billing side of it is fairly new.
It isn't. I've been doing it for. I'll be in my 20th year in August.
Okay,
So
that's
it's
not
not
new.
new. It's just a matter of knowledge.
Yeah.
And so that's why the education portion, and I'm not going to lie, our software is not for everybody. It might not be that you're ready for it. When we do our education, we're going to show you every way that you can bill. It's not about our software. It's about, if you want to use our software, it's available. But if you're not there yet, it's okay. We'll show you the other ways that you can get this done. So if you say, I'm only going to do 1 claim a month, not a problem.
Okay.
Come to the course. We have a 2-day course. I'm going to show you every way to get it done. And so that to me is, we made it a priority that do we think we have the greatest software? We do. But but
Of course we do.
I actually told a doctor the other day, you're not ready for us because you've got to get a lot of other things under control first, and I'm not going to waste your money.
Right.
We can't do that. We should not be saying that everybody has to sign up for our software, because it might not be that you're ready or your team's not ready.
Right.
And so that to us is important. That's why we recommend you get a coach, you get somebody to help outside eyes into your practice to see where you're at. And then from there, just know we'll be here.
Love
When
it.
you're ready, we'll be here.
Love it. Um, I love that you brought in the team and the training part of that. And I coach 2 practices on their team alignment, their culture, and the leadership side of things. Um, Getting prepared for that. You do. I mean, I've spoke to you at length about leadership and team culture and training and things. You know so much about a practice. You've worked in the industry, like you said, for over 20 years. You've been inside periodontal, correct? Practice for many years. So what do you think to prepare for this next level? Is it, what does that preparation look like?
Documentation.
Okay.
If I had to pound on one thing,
Okay.
it's the documentation, because the doctors have this clinical knowledge of the why. And it's great knowledge, and sometimes I have to bring it up and they're like, oh yeah, that yes, that's exactly why. And I say, but you got to put it in your notes. And so you have to, you remember, your notes are only as good as how your team is hearing you speak. So if you're focused on teeth, 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 guess what they're writing? Teeth, 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 teeth. When you're really thinking about the structure and how it's going to affect them as years go by, and that they're not going to be able to maintain the same level of oral care because of some kind of dysfunction or malfunction within the oral cavity. So if you remember that when they're taking notes, they're everything you say they're trying to capture. So if everything you say as a doctor is about the teeth, that's what your note's going to be about. That's not a medical issue.
Right.
Whereas if you speak about, I know you probably haven't noticed that your mouth is dry, but we did a pH test today and you have a really highly acidic oral cavity. That means you've been walking around with this dry mouth for a long time, and this is what it's caused. So do you see the difference in just
Big
how
difference.
you can say something and how your team is recording this?
Right.
And that is what the key is. The doctors already know this stuff. They already have the two and two. Hygiene already knows this stuff. It's focusing on what you can fix, making sure the patient knows the why, that, it's not their fault sometimes.
Right.
You're on ADHD medication or anxiety medication. That is highly xerostomach. But they might have lived with it for so long they don't even recognize it anymore.
Right.
But that's why they have so many caries lesions. That's why they need so much work. And so explaining this to a patient helps them understand. And then what could they do to help it? Whether it's Saliva Max or any kind of biotine. We talked about this. I have a mint allergy, and all those products have mint, but I can use a higher pH water to regulate my oral cavity because I am xerostomach. And with that higher pH water, that makes, because usually I get over a 9, and mine is my oral cavity is at a 5.5. So it balances me out to normal. So
Wow.
that's what helps me, and that's why I don't. Now, do I still have caries lesions? I do. I actually have to get 2 done next week, but I don't have as many as other people do. And those are the things that you have to learn. Xerostomia is so highly prevalent in our arena in dentistry, but we always go back to, well, the patient didn't say so. Well, you see all the medications they're taking.
Mhm.
I used to say to our patients, if I snuck into your house before you got out of bed and asked you to spit in a cup, could you do it? Most of the people would say no.
Really?
Yeah, because if you're on anxiety meds, those are like number one. Anxiety meds, even any gastric meds, they're all going to cause xerostomia. It's like number two side effect, um,
Interesting.
other than death,
Right.
because
Right.
everything causes death, and apparently with medication. And
Right.
so, we just have to make sure we're putting two and two together.
Yeah.
If a doctor sees a patient 6 months ago and everything looked good, didn't see, and now 6 months later you see 4 caries lesions and they need a new crown, what happened?
Right.
Because that didn't happen over a 6-month period. They know it, we know it. So we got to ask better questions. And
Mhm.
that all comes from the documentation. If we notice what their health history is, if we notice what their medications are, and if the patient says nothing's changed, guess what? Something's changed. Now, they might have increased dosage, and that could have started that xerostomia all over again, creating it in a more severe manner.
Mhm.
But we're not asking. We're just saying no health history changes. But have we asked the specific question? I
Yeah,
noticed
I
you're
find
taking
that to be
blood
a,
pressure meds, right? Has
yeah.
has your doctor changed your dosage or added anything to that? How has that been? How do you feel? I think that's where we need to make a lot of changes.
Yeah, I agree. I love that you brought up has anything changed? Because I think that question alone is the worst question. It should not even be a part of the dialogue.
Right.
Um, because it puts everything, oh, since when? Or what was the last thing I wrote down? Or, so it's
Right.
just so
Right.
vague.
Well,
Um,
plus the fact that a lot of people, the way society has created it is that the mouth is not part of your body.
right.
And so we have to get them back to realizing that your mouth talks to your body and your body talks to your mouth.
Mhm.
And so but who's it going to come from? It's going to come from us. You know why? A lot of medical doctors don't know about
Right,
the oral cavity.
right.
It's not that they're not smart. It's not that they're not talented. It's not that they don't have your best interest at heart. They just don't know that correlation. So we have to be able to be the ones to ask.
Yep, yep. And they are the educators of that. If we are not educating the patients what to look for, how to respond, how important it is, the oral systemic link honestly is new dialogue for me. Since meeting you and talking with I met you through Teresa Shepard. We've had a lot of conversations around that correlation between your mouth and your body. We're all one human being and all of our parts work in hopefully in harmony. And when they don't, um, that's where you come into this
And that's the goal is to help the
right.
patients get better faster.
Yeah.
That's the way I look at medical billing. It's not that it's not there has to be the education, but there has to be education with almost anything we do.
Yeah,
And so
absolutely.
don't let the fear of medical billing stop you from helping your patient. Because I've actually had patients find me on YouTube and ask me to send them to a doctor that bills medical.
Mm,
So we have
interesting.
to remember if patients are looking online for something outside of the box, who is that going to be?
Right. I love that you said that. Okay, so speaking of YouTube and all of the different ways that you educate people, what is the best way to find you?
Devdent.com. See, I think it's over here.
Yep, it's right about.
Devdent.com. And there's webinars on there that you could watch on demand. There's also a demo at the website of the software if you're just interested to see what it's about. Um, I think I have a webinar coming up on fraud, April 23rd. So we're going to
Yes,
talk
and I
about,
saw that. I'm excited to actually, that was one of the other questions I know we're running short on time, but I wanted to ask you, what are some of the risks associated with medical billing, like if, and the potential
so the
for
risk
fraud?
is when the doctor says, we'll just bill it to your medical, it'll be okay. No, that's a surprise, the Surprise in Healthcare Act. So you can't do that. You only can give them what you know from dental insurance. What we do on the medical side is purely courtesy.
Okay.
So if you tell them that not to worry about it, guess what? And you send them a bill, you're in trouble.
Yeah, yeah,
So it's as simple as that. If you
yeah.
look at it as this is a courtesy that we do for our patients, we don't know how they're going to pay, how they're going to process. And so we want you to know your estimate is based on what we know, which is what the dental insurance will do. So
Awesome.
if you think about it that way, you're not going to be in trouble because your patient has no expectation. And so this is truly a courtesy that we provide for patients.
Love it. I love it. That's so great. Any last thoughts around where they should begin, what the process should look like, how they
So
get started?
I do a lot of so I do on-site training, on-site working specifically with a team. So I spend 2 days, one day with the whole team and then one day with their medical biller just to get them on track,
Mhm.
get a system and a process in place of how they can get it done. So that's one way. The other way is, software. If you buy, our highest package is $129 a month, and it's unlimited coaching and claim support. So
Wow.
those are the ones I Zoom with every week, and
Yeah.
we review and we go over their cases and we come up with how it could be coded and things like that. So there's just multiplicity of ways. There's 2 day courses that, in fact, I'm scheduling one today with Patterson and San Diego. So there's the 2 day courses which provide you tons of information as well as a workbook, which does not get sold. So you can't go to the website and buy the workbook. It's written and given to the course attendees only. So those are the things that we provide as a gift, as well as PDF. Actually, not PDF. They're Word documents that you can make edits to, so that you can make it appropriate to your practice. And then the 2 day course kind of gets you to where you can decide what is the best way for me to bill. Is it through a portal? Is it through our company? Or is it, I'm going to try it on paper first? So it just kind of gets you to the point that you can make that decision of what might work best for you. But it also still will give you all sorts of education that you need.
Yeah, that's great. That sounds like a great starting point if you're not already a part of it to get enrolled into that 2 day course. Absolutely. Okay, devdent.com, correct?
Ma'am.
All right, Laurie, I am so grateful to have you
Oh,
a
wait, now
part of.
my email address is going to be weird. It's Laurie@devdent.com. So if you need to email me, you can email me.
Great. Oh, thank you so much. Well, have a wonderful rest of your week, and I look forward to introducing you to more and more clients. It sounds like they need to be a part of your world.
Thank you so much, Laura. I appreciate you.
Thank you.